Beautiful patient of ours, what we are doing today is Masseter toxin. So usually use toxins for the forehead lines, the frown lines, the crow's feet, etc. So Masseter hypertrophy can be treated easily with botulinum toxin. So what I'm going to be doing here is going to be marking how to inject for the Masseter. So first thing what we have to do is do the lower border. So first we got to mark the lower border of the mandible, and then what we do is usually you mark the posterior border of the mandible like this. So this is going to be my posterior border. So the next thing is what we will do is mark the upper border. So the upper border, what we do is basically we draw a line from the corner of the mouth to the tragus of the ear. So this is going to be my the upper border. So we should not go above this because we have the zygomaticus major muscle which comes like this, and we could kind of, if you go higher than this, there is a chance that we might hit onto the zygomaticus major muscle. Apart from that, so just clench karo, daan se daan milao. Yeah, so you can feel the masseter probing out like this. So my masseter is here and we draw the anterior border. So this is going to be my anterior border. Now what happens is if we divide this masseter, this area into 6 parts like this, okay, so the rhizoris muscle normally comes here like this, and this gets inserted onto the superficial fibers of the masseter in this 1 and 2 area. So our main target should be here, and there could be some chance if you're injecting in the anterior border of the masseter here, there is a good chance that we might be kind of infiltrating a few toxin units into the rhizoris, and that can actually cause asymmetrical smile. So our main area should be into this area of the masseter, where the bulk of the masseter is. Now what I have done is I have reconstituted CX. So I have just reconstituted CX 100 units. So what you do is basically we use 2.5 ml of normal saline, and we we reconstitute it to 2.5. So each insulin syringe, which is about 1 ml, so this contains about 40 units, as I've explained you many times. So this is the 1 ml syringe, and this has 40 units here. But then here we normally don't use an insulin syringe because we know the masseter is almost like 12-13 millimeters in thickness. So we use this 6 millimeters of insulin syringe, the needle. So this basically doesn't go deeper into the masseter. So we use something called as a tuberculin syringe, which is the needle, if you see, it's pretty much longer, and it goes into the masseter, and that kind of helps into kind of pushing the toxin into the deeper layers of the masseter. Okay, so what we will be doing is I have loaded 25 units of CX here, and what I will be doing is I have cleansed this area now earlier, okay, and I have marked this, cleanse it once again. Ask the patient to clench. So this is about 25 units which I will be injecting into 5 different points. Bulk is here, tight is here. Yeah. This is the bulk of the masseter. I go deeper inside it, and wherever the bulk of the masseter is. So you have to be very careful not to be in the anterior segment. Okay, and we are done here. So this is my 5-point injections of the masseter. So this usually takes about 3 to 4 weeks when you start seeing the masseter slimming down. Although we will be scheduling her in the first week of next year for doing her forehead. We'll be doing the masseter reduction, the gonial angle reduction, the chin implants, the rhinoplasty, and a hair transfer for her. So but then at this point of time we are going to be doing a simple a non-surgical modality to help her till kind of she goes in for the other surgeries. So now in the same way here, this is going to be my lower border, anterior border. दुख रहा है? कहाँ?
पहले नहीं दिखा था, अभी दुख रहे बहुत, उस टाइम नहीं दिखा था.
Okay. So this is my elateral line. Okay, clench karo. Yeah, you can see the bulk of the masseter here, and this is my bulk of the masseter. And if you see here, this is my bulk. So my main points of injection.
ये भी ज्यादा है.
हाँ, ये ज्यादा है, तो थोड़ा ज्यादा डाल देंगे इधर का, ठीक है ना. So she herself is saying that her left side masseter is little more bulkier. So I'll be injecting about 30 units here because she herself is complaining. बस हो गया. छोड़ो ढीला, ढीला छोड़ो. वेरी गुड. टाइट करो. Sorry. That's it. So that's how we do Masseter Toxin. So what we normally tell our patients is usually it may take up to 3 to 4 weeks when you start seeing the results. The masseter starts slimming down. The final results would be in about 8 weeks time. You would see the slimming effect. So when we talk about kind of number of sittings, we might require another sitting after say 3 months. We normally suggest 2 to 3 months is when we normally ask the patient to come back for another sitting, and then normally the masseter slims down, and probably the patient requires this next sitting after 1 year or 1 year, 1.5 years, when the patient starts seeing the masseter coming back and getting hypertrophic again. So that's how we do Masseter Toxin for the face slimming.